Bismillahirrahmanirrahim. Quote of the day is whoever is kind, Allah will be kind to him. Therefore, be kind to man on the earth. He who is in heaven will show mercy on you. This is the quote from the greatest leader, Prophet Muhammad Sallallahu Alaihi Wasallam. My name is Dr. Aamna Khalid. I am a PG trainee of Community Medicine in Institute of Public Health, Lahore, and I will be presenting the topic of leadership under the current supervision of Supervisor Professor Dr. Saira Afzal. The learning objectives for today's presentation are we will define leadership, we will go through the leadership grid, different competencies and networks of the leadership challenges in health sector of Pakistan, and then we will do the practice of MCQs. So why leadership matters in healthcare? Because hospitals fail due to poor leadership, not only due to poor resources only. Public health programs depend on leadership. Crisis response requires leadership, and leadership affects patient safety as well. So we define leader as a person who influences, guides, and motivates individuals or groups to achieve a common goal. Leadership is influence, not authority. It's vision driven, it's goal oriented, and it's people centered. A leader is a person who provides direction, inspires others, takes responsibility, makes decisions, acts as a role model for his people, and creates positive change. A leader does not necessarily hold a formal position, but leadership can be informal or formal as well. So, difference between leadership and management, or a leader and a manager, is that leadership has a vision and planning is more focused on management is more focused on planning. A leader inspires people while a manager controls the processes going through. A leadership is change oriented while management is stability oriented. A leader influence while a manager has the authority. What makes an effective leader? An effective leader possesses different traits. Traits are the inherited qualities and attributes which are developed personal characteristics, and the skills which are the learned abilities. These three together determine leadership effectiveness. First of all we will see the leadership traits. Traits are relatively stable personality characteristics, and some major leadership traits are the intelligence, self-confidence, determination, emotional stability, sociability, courage, initiative, resilience. For example, confidence and resilience help leaders handle the crisis. Then the leadership attributes are the positive personal qualities which are developed over time. So the key leadership attributes are integrity, accountability, ethical behavior, adaptability, open-mindedness, transparency, empathy, professionalism. All of these can be developed over time. So the attributes shape a leader's character and credibility. Then there are some leadership skills. Skills are the competencies that can be learned and practiced. Some major leadership skills include communication skills, decision making skills, conflict resolution skills, strategic planning, team building, negotiation, problem solving, time management. All of these skills improve with training and experience. Then the next concept is leadership competences. Leadership competencies are observable and measurable abilities that enable leaders to perform effectively within complex systems. They actually combine the knowledge a leader has, skills, behaviors, and attitudes. These competencies are developable and context based. There is a network, National Leadership Network, which was established in United Kingdom to develop leadership capacity across sectors, especially the public services and education. This framework identifies four major leadership competency clusters. First one is core transformational competencies. Second is political competencies. Third is trans-organizational competencies, and fourth one is team building competencies. So the first one, as mentioned, is core transformational competencies. The major focus of this one is leading vision and change. So develop and communicate clear vision, inspire and motivate others. A leader leads and manage changes, encourage innovation and creativity, strategic thinking, uphold ethical values. These things are included in the core transformational competencies. Then the second one is political competencies. The major focus of it is on navigating power and policy. For example, to understand governance and policy systems, influence decision makers, advocate for organizational goals, build strategic networks, negotiate and manage stakeholders, and navigate organizational politics. Then the third one was trans-organizational competencies. The focus of it is on leading across systems. This includes like system thinking, build cross-sector partnerships, collaborate across different organizations, lead networks and alliances, understand broader social context, and promote interagency coordination. Then next one is the fourth and last one included in the NLN network was team building competencies. The focus of this competency is on building effective teams. For example, this includes effective communication, trust building, conflict resolution, coaching and mentoring, empower and delegate, and foster collaborations. Then another thing is social network analysis. This is a method to study who is connected to whom and how information or influence flows in a group. This includes, again, four things. First one is peer leadership network, second, organizational leadership network, and third one is field policy leadership network. Fourth one is collective leadership network. So the peer leadership network is where people at the same level lead and support each other. For example, senior residents guiding and supporting each other during their training program. The second one is organizational leadership network, where connections among leaders within an organization that influence decisions and performance. For example, hospital department heads coordinating about the patient care. Third one is field policy leadership network. This is a network of leaders who shape policies in a specific field, for example, in health or education. The example includes public health experts working together to develop national TB guidelines. Fourth one is collective leadership network, where leadership shared by many people working together rather than one single leader. For example, a multidisciplinary team jointly leading a community health program. Then the next concept is about the leadership styles. These are the three classical leadership styles: autocratic, democratic, and laissez-faire. Uh, as you can see, the autocratic one, where the leader is saying do X. He's not giving any option. He is just giving an order that do this thing. Then the second one, the laissez-faire, where he is giving the option that you have the option do X or Y as you see fit. Then the democratic one asks the people that which one is best, X or Y. Okay, these are the five leadership styles. Autocratic, where leader makes decisions alone. Strict control and supervision, useful in emergencies or crisis situations. Then the laissez-faire, where there is minimal supervision, employees work independently and suitable for highly skilled and experienced teams. Then the next one is transactional, which is based on rewards and punishments, focus on the rules and targets and performance, works well for the routine tasks. Then the next one is democratic or participative, where team members involved in decision making, encourages ideas and discussions, and improves motivation and teamwork. Then the next one is transformational, which inspires and motivates followers, focus on the vision, change, and innovation, builds commitment and enthusiasm. Then the next thing is leadership grid, also called managerial grid. This grid explains leadership styles based on the two dimensions. First one is concern for the people, and that how leader care for the staff, relationships and motivations. And the second thing is concern for production, that the leader has also focused on the work, performance, and results of his or her organization. Both of these are measured on a scale from 1, which is lowest, to 9, which is highest. This leadership behavior depends on how much importance a leader gives to people and the task or the work done in the organization. So these are the five styles covered in leadership grid. The first one is impoverished management, um, which has the lowest score for both of the things, the work and the people. The characteristics of this style is minimum effort and avoids responsibility as well. The second one is country club management. The characteristics includes a friendly environment with the people, but low productivity in the organization. Authority compliance or autocratic, where high task is performed but low concern for the people. Middle of the road is a balance between concern for the people and concern for the work, and it averages the performance. Team management is the ideal style where the highest score is given to both the things, the work and the people. There is highest productivity and high staff satisfaction. So best leadership style is team management because the leader motivates his staff, encourages participation, and maintains high performance. This is the graphical presentation of this grid. You can see that the lowest score is for the impoverished leader, highest score for people, but the lowest score for production is in the country club leader. And authoritative leader has the highest score for production, but lowest concern for his people. And team leader is the ideal situation where 9 score is given to both of the things, the production and the people. And then the next concept is about measuring leadership effectiveness. Why we have to measure leadership? Because the leadership effectiveness is not based on the position or authority, but on the observable behaviors. To assess effective leadership behaviors, the two scientists proposed 5 practices of exemplary leadership, which are based on the broad behavioral patterns consistently demonstrated by the effective leaders, and 10 commitments of leadership, which are specific actions that leaders take under those 5 behaviors. So why do we use this method or model? Why do we measure the effectiveness? To identify strengths and areas for improvement, to develop leadership skills systematically, to guide leadership training and evaluation, to promote evidence-based leadership practices. So the first practice included in this is model the way. And the commitments included in this practice are first one is set personal example by aligning actions with the principles. And the leader clarify the values to his people. Second practice is inspire a shared vision. And the commitments included in this are envision the future possibilities and enlist others in a common goal. All right. Third practice is a challenge the process, and the commitment included are seek opportunities for the innovation, take risk, and learn from the mistakes. Fourth practice is enable others to act, and the commitments include build trust and foster collaborations, empower the team members, and recognize their contributions. The fifth practice is encourage the heart, and the commitment includes celebrate the accomplishments of the people. The next concept is about measuring innovativeness of a leader. Innovativeness of a leader refers to the ability to generate ideas that go beyond routine practice and improve or transform the systems. The degree of innovation can be assessed using 6 levels of thinking. These are the 6 levels of thinking. We will go through the detail in the next slides as well. The level ranging from 1 to 3 are the incremental improvement thinking levels. The first level is usual thinking, where there is a typical routine approach. Same method is used by the leader as used by most of the other organizations, and there is no significant change. The second level is potential better practice thinking. This is the adaptation of ideas already used elsewhere, but this is new to the organization and common in the other fields. The third level is about the clever thinking. This is a smart modification of the existing model or method. This is a small scale creative improvement. The next three levels are the levels of transformational thinking. The fourth one is creative connection thinking, where the leader borrows some idea from other industry or field, but this idea is rarely used in his current organization or sector, for example, the health sector. The fifth one is paradigm busting thinking, where the leader challenges the traditional beliefs and practices and breaks the existing mental models. The sixth one is the original thinking, where the leader proposes a completely new concept never previously used or imagined, and this is a true breakthrough innovation. Now we come to the leadership challenges in Pakistan, especially the health sector. Um, A political interference and weak governance, limited health budget and inadequate infrastructure, shortage and uneven distribution of healthcare workers, more in the urban than rural, brain drain and low staff motivation, bureaucratic delays and poor coordination, weak monitoring, accountability, and database planning. This was just an introduction of the topic of leadership. In the coming classes, we will go through the detail of different theories of leadership as well. Now we come to the practice of MCQs. The first question is, during a measles outbreak, the medical superintendent makes all decisions alone, gives direct orders to staff, and does not take suggestions from nurses or residents. This leadership style is option A democratic, option B laissez-faire, option C transformational, option D autocratic, or option E transactional.
D.
D.
Yes, option D is the right answer. Question number 2 is, a public health officer motivates staff by sharing a future vision of a polio-free district and inspires commitment to vaccination campaigns. And this is option A, autocratic leadership, B, transactional, C, transformational, D, laissez-faire, or option E, authority compliance leadership.
C.
C.
Yes, C is the right answer because he is inspiring the people. Question number 3 is, a hospital leader gives equal attention to staff welfare and high productivity as well, resulting in both satisfied employees and excellent performance. According to the leadership grid, this is option A country club management, option B authority compliance, option C impoverished management, option D middle of the road, and option E team management.
Team
D.
management.
D.
E.
Yes, option E is the right answer, team management, which was the best style. Question number 4. A medical officer copies a vaccination strategy already successfully used in another district and applies it locally. This level of innovativeness is option A, usual thinking, option B, clever thinking, option C, original thinking, option D, potential better practice thinking, and option E, paradigm busting thinking.
B.
B.
Mm, give me a second, please. No, this is D, potential better practice thinking. Question number 5 is, a hospital manager introduces a completely new telemedicine model never used before in the region. This level of thinking is option A, usual thinking, option B, clever thinking, option C, original thinking, option D, creative connection thinking, and option E, paradigm preserving thinking.
C.
C. Charlie.
Yes, Charlie is the right answer because he has introduced a new concept which was not used in the region before. Question number 6 is our leader encourages collaboration, builds trust, and empowers members to work independently. This corresponds to which exemplary leadership practice? Option A, model the way. Option B, inspire shared vision. Option C, challenge the process. Option D, enable others to act. And option E, encourage the heart.
B.
B.
Option D is the right answer because he has empowered the team members to work independently and made them unable to act. Option C, question number 7. Health leader negotiates with policymakers and stakeholders to pass anti-smoking legislation. This competency belongs to option A, team building competency, option B, core transformational competency, option C, political competency, option D, trans-organizational competency, and option E, technical competency.
C.
C.
C is the right answer because he has negotiated with the policymakers. So this is the political competency. All right. Question number 8 is in a hospital staff like their administrator because he is very friendly and supportive, but productivity is low and work targets are not achieved. According to the leadership grid, this style is option A, team build management, option B, authority compliance, option C, middle of the road, option D, country club management, and option E, impoverished management.
D.
E.
D is the right answer. You can go through the graph later on that country club management is where the leader has least concern for the productivity of the organization but is supportive to his people. Question number 9 is a hospital director forms a multidisciplinary team of the doctors, nurses, pharmacists, and administrators and encourages shared responsibility in planning a new infection control program. This best demonstrate option A, political competency, option B, team building competency, option C, transactional leadership, option D, authority compliance leadership, and option E, impoverished management.
B.
B.
Yes, exactly. This is B, team building competency. Question number 10 is a hospital leader involves nurses and doctors in decision making and encourages discussion before finalizing a plan. This leadership style is option A, autocratic, option B, democratic, option C, laissez-faire, option D, transactional, and option E, impoverished.
B.
B. B.
Yes, B is the right answer. This is the answer key to all of the questions. This is the YouTube channel of Institute of Public Health Lahore, where this presentation will be uploaded later on. Thank you so much.
Thank you so much, Dr. Amna.